You're listening to Compliance Conversations, your inside scoop on all things healthcare compliance, auditing, and coding. Now, let's get on with the show.
Welcome, everybody, to another episode of Compliance Conversations. I am CJ Wolf with Healthicity, and today our guest is Stephani Scott. Stephani, welcome to the podcast.
Thank you, CJ.
I am so excited that you agreed to talk to us a little bit today. We've got a great topic. Stephani has a lot of experience in many areas, but especially in the one we're going to talk about too. But Stephani, before we get into our topic, we always love to have our guests tell us a little bit about themselves, maybe your professional background, what you're doing currently, anything you're comfortable sharing.
Sure, would love to. So my name is Stephani Scott. I am the VP over AAPC services here at AAPC. I've been with the company over 13 years.
Wow.
And during that time, I do have to say it's been my favorite part of my career. I've been in healthcare over 30 years. And here at AAPC, I get the wonderful opportunity of working with different practice organizations, from one doc practices to large academic health systems. I work with health plans. I work with other revenue cycle groups. And so it's really super fun to work with all these different organizations and help partner through the rev cycle, the different challenges that they may have. So I'm very happy to be here. Thanks for asking me to join.
Yeah, and you guys do audits. You also probably do like proactive training, and tell us a little bit more, if you're okay, about the kinds of things, the breadth. I'm always surprised. You guys do a lot.
Of course. So our main focus of services that we provide are coding and documentation audits for professional services as well as facility services. So we get the opportunity to work with these different groups and help participate in their compliance program around the coding and documentation reviews or focused reviews, at-risk reviews, things like that. We also work with different attorney groups as subject matter experts if we need to review specific cases and or do expert witness testimony. So we've got a team that does that. We also have a team of trainers that will come in and do either new provider education training. Mostly we provide training and education based off of the audits that we do, where there's different opportunities for clinical documentation improvement. So we might work with individual doctors or do those sessions in groups, or even go on site. Now the last couple of years, we've been starting to get quite a few requests from customers to come on site and help their organization.
Very good. Very good. And I know Stephani well, and I know a lot of her team members, and they're a great group of professionals. So if you need help in those areas, I highly recommend you reach out to Stephani. And Stephani, we want to talk today about one of the things I know you guys do, and that is IROs, or independent review organizations. You do that line of work, don't you?
We absolutely do.
Yeah. Tell us, just for our listeners, our listeners, we have a lot of coders and auditors, but we have a lot of compliance professionals as well. Not everyone might not know what an IRO is and what context that's in. You want to tell us a little bit about what an IRO is?
Sure. So if an organization is found by the OIG to have some discrepancies in their documentation and coding on billed claims, that they might have to go under, help me out, CJ, what's the...
the CIA, or the Corporate Integrity Agreements.
Yes, the Corporate Integrity Agreement. And usually those last for a couple of years. Typically, we see about 3 years that they're under that Corporate Integrity Agreement. And so one of those requirements is that organization search out an independent review organization to perform those audits on a monthly or quarterly cadence. It really depends on what those different stipulations are with that agreement that they have. So that's how we get pulled in, is, we can serve as that independent review organization where we don't have any bias or any connections with those organizations. We actually have to sign a certificate of independence
Right.
that attests to that. And then we
Yeah.
get that opportunity to work with the different groups under that agreement.
Yeah. Yeah, and you and I were talking about this a few weeks ago, I think, and you know, I read a lot of corporate integrity agreements, and most of some of our listeners do as well. And we all know that CIAs are public, so you can go on the
Mhm.
OIG's website, you can look at those, and when a CIA requires an IRO, there's usually like an appendix of kind of the requirements. And to Stephanie's point, you have to certify to being independent, right? So you haven't worked for them before or have some sort of bias potentially. And so you certify to some independence because the OIG wants, you know, an entity external to go in to do a review and to give, you know, as independent as possible type of opinion on how the coding and reimbursement is going. So um so you do organizations reach out to you when they're, or maybe their attorneys reach out to you when they're in search for an
It,
IRO? Is that basically how it begins?
yes, that's exactly correct. It's usually through their compliance.
Okay,
Sometimes it is through their attorneys.
gotcha.
And so they do reach out to us and they, go through that discovery process. Is it a specialty or a um, services that we have experts in? And, we go through that process. And once we're under engagement, then we can begin that work. So one thing that often when organizations reach out to us, they really misunderstand what our role is.
Yeah,
Typically with our customers, we like to partner with our customers as we're part of their compliance program and we're helping them work through some of that and doing training. But in this instance, we have to stay independent. And so that organization that are under that corporate integrity agreement have to do all the work and they have to meet the requirements of that agreement. We're just here to do that work. And so I often, we have to work through some of those logistics with
yeah,
customers where this is a new experience for them.
yeah. And I'm sure it is new for people because, you know, corporate integrity agreements, they are common enough that we see them, but not, you know, common in every like provider, right? It's such a small
Right.
percentage of providers that might need those. And so they might be used to working with third parties that, you know, are, you know, they're embedded in the organization and they're helping this and that. And so that's a good point. You have to first kind of clarify that, well, our role is very, very specified by the OIG, right? It's
Mm-hmm.
independent. We're supposed to follow certain rules. We're supposed to do a review of some sort. Tell me a little bit about the reviews. So like what topics are you reviewing? Is it coding, hospital, professional, technical, all of the above? What, tell us a
Yeah,
little bit about those kinds of things.
it's really been all of the above. We've had many different projects for where we were the IRO, and it can span across different specialties, um, from ophthalmology, DME, so like lenses
Sure.
and contacts, things like that. It could be facility services, it could be other professional services, pediatrics, surgery, podiatry. I mean, it
Okay.
really has spanned across the spectrum of the different services and specialties out there. But I will say that every CIA has been very different, and exactly what we do as the IRO has been a little bit different. But overall, the process is, we understand what those requirements are, and then we set up a schedule because these CIA agreements are very time sensitive. Like you have
Right.
to perform certain pieces of the project within certain lines. And then,
Right.
we're held to that same timeline for our customers that we are the IRO for. So we kind
Yeah,
of
that makes
look
sense.
at it that way.
Yeah, because you're probably going to be reporting, or I don't know if you report directly to the OIG or if you report to the organization and then the organization reports to the OIG, but somehow the OIG is expecting some sort of report back, right?
That's right. In not one instance have we reported directly to the OIG. We report directly to the the organization that has the CIA agreement.
Gotcha.
And, we help them, like we always do reminders because everybody gets really busy, and we make sure that the sample selection for the review meets the specific requirements. We make sure that we do the work. All of our work has a second tier of quality review that will go over that. Sometimes it's just a coding and documentation review. Other times we also include the rev cycle piece where we're seeing those claims. Once that random sample selection is made, we'll do the review from the start to the end.
Gotcha.
Meaning, we're not just looking at the documentation coding, but we're also following the process of the claim. Was that properly done within the organization, and payments received, and it was proper, and all of that. So once that's done, then we put together a formal executive report, making sure that we're meeting all the specific elements required in that CIA, and then we deliver that to the customer. And then the customer will then complete a few other items and forward our documentation along to the OIG.
Gotcha. That makes a lot of sense. We're going to take a quick break, everybody, and then we're going to come back and ask Stephanie some more questions. I got some more questions about IROs, but I just think it's a fascinating topic. So hang tight, everybody, and we'll be right back.
Compliance is complex, which is why you should visit Healthicity's Resource Center. It features updates on the OIG's new General Compliance Program guidance, CEU webinars, and more. Visit healthicity.com/resources today.
Welcome back from the break, everybody. I'm talking with Stephani Scott, who works for AAPC Audit Services and leads that team, leads that whole enterprise and work. And we're specifically talking about IROs. And Stephani, you were talking about picking a good sample size. I don't know if you do this, or maybe you have experts on your team that use certain like statistical software, or how are you picking those samples? If you don't know details, that's fine, but maybe just principles.
Yeah, absolutely. That's such a great question, because it's such an important part of performing the work as an IRO. Usually in the agreement, there's a set sample size that needs to be had, 30, 50,
Okay.
somewhere along those lines. And it really depends on if it's individual providers that we're looking at, or if it's as a group. So once we identify those parameters, then the sample selection, we do perform those. And if it's required that the sample is done by RAT stats, then we put that through the RAT stat calculator. We'll get all of the claim data for that specific universe and time. It's usually by the quarter, paid claims, the previous quarter. So we'll get that sample selection, run it through RAT stats. Other times, the sample selection within the agreement would have more of a focus sample selection. Maybe we're just looking at specific types of claims, like level 4 E&M services or what have you.
Mm-hmm. Yeah,
So,
that makes. Sorry, go ahead.
No, you go ahead.
I was going to say that makes a lot of sense. And I was just going to say, some of our listeners might not know about RAT stats. So I was just going to say, you correct me if I'm wrong, but RAT stats is a free statistical sampling software that OIG offers on their website. And I think I can probably get everybody the link to the OIG's website, but it's a software system you can use to help. If you have a sample size of 10,000, it helps you do the statistics to know what your size has to be, or I'm sorry, your universe is 10,000, and then the sample size would be an appropriate size depending on the confidence interval you want and all those sorts of things. Am I somewhat right in
You're
describing
spot
what
on,
RAT stats is?
CJ. Yep, you're spot on. But what it also does is it not only gives you the sample size for a valid statistical sample, it will also randomize and select the sample for you. So it's completely 100% unbiased.
Gotcha. Yeah. So a lot of people think, random is, I'm just going to take every fourth one. That's actually not even random. So I think this statistical software is doing all that science, right, to figure out what is truly random.
That's correct. The other thing that's important with your sampling is to make sure that you identify a couple of extras. There's
Okay.
oftentimes a situation where, for whatever reason, documentation's not complete, or something happened where the a random encounter doesn't meet the requirement or isn't available for review.
Yeah.
So
Yeah,
you
that makes
always want to make sure you have a couple of extra, and in your report, you call that out specifically.
Gotcha. Yeah, that makes good sense. And I'm assuming, Steph, so a lot of our listeners probably might not ever be under a CIA, but these skills that you're talking about and these processes are probably useful if you're just internally trying. Let's say you've identified a problem and you might have a potential payback and you want to give the government, kind of sound reasoning as to the dollar amount you came up with. Because let's say it's been going on for 4 years and you've got 20,000 claims. I don't think anyone expects you to review all 20,000, but you could use rat stats in like in an investigation that your compliance program's doing. And then that same kind of reasoning would, I think, most of the time be acceptable to the government when you're kind of self-disclosing.
Absolutely. The process is very, very similar. Oftentimes, organizations will want an external vendor to come in, almost act like an IRO, right? Because
Right.
that just is better if you're doing a self-disclosure, it just adds value to when you're disclosing to the payer.
Mm-hmm. Right.
The error that occurred and what you're suggesting the payback might be. But yeah, that's exactly correct. You get that paid universe by payer.
Mm-hmm.
Let's say, for example, it was an issue with an EMR update and something happened and claims went out in error because of this EHR issue, right?
Right.
You would have to do RAT stats by payer. Some
Okay.
people think you take the entire universe, but that would be incorrect because you're going to send a separate self-disclosure to each payer. So you would
Gotcha.
run that process by payer.
Yeah. No, that makes sense. And I'm thinking that when I mean, because RatStats is free, so any compliance program could use it, or coding or revenue cycle program. Um, is it hard to use?
It's a little tricky. You do just need to read the instructions and follow it.
Mm-hmm.
But we haven't had any trouble.
Okay.
Our non-coder staff usually runs through that process for us, and we have found it fairly easy to use. Every once in a while, we'll get a file that will kick out, and we just need to change the file format. And maybe we didn't have the exact information that we needed on a couple of the line items.
Yeah.
So you just kind of have to, troubleshoot that a little on your own. But for the most part, it's fairly easy to use. You just need to read the instructions that CMS has out there, and it's
Mm-hmm.
very easy to find and troubleshoot from that way. We haven't had to, call CMS, for example, up and ask
Right.
for help or anything like that.
Okay. Yeah, good to know. And I know in reading, sometimes I read OIG audits, like where they're doing an audit of, service XYZ, and sometimes in their appendices of their reports, they'll outline the steps they took to identify their sample. And so sometimes I've even seen them say they've used rat stats themselves. And so it is a pretty methodical process. And I think most of us could probably figure it out, like you said, if you just read those instructions and follow those instructions. I wanted to ask too, are you aware of like acceptable error rates, or is that kind of beyond what you guys do? Sometimes I've seen, this has been a long time ago, I don't know if the OIG is doing it anymore, where they'll say like in their CIA or in their review expectations that, if it's greater than a 5% error rate, they expect you to do X, Y, and Z. Do those types of percentages or error rates, acceptable error rates, ever come up that you're aware of?
Absolutely. So OIG still has a standard of a 5% error rate. I have not seen any changes with that since I started at healthcare and started doing these types of audits. So that is the industry standard that we use with the CIA agreements. I've often have seen them call out the 5% error rate. I
Uh-huh.
have not seen anything greater than that.
Okay.
And of course, in some agreements, I have seen a less than a 5% acceptable error rate. So those have been
Gotcha.
kind of far and few in between, and it kind of depends on the particular scenario.
Yeah. Well, with Medicare and the different payment methodologies, I would imagine they might have different instructions. So like, nursing homes are paid, through a different methodology than, physicians, Medicare Part B fee schedule, for example, or I'm thinking also now through Medicare Advantage. Do your IRO activities get involved in those other payment systems like Medicare Advantage and risk adjustment and those sorts of things, or are those different kinds of audits?
No, we have most often as an IRO, we've been tasked with performing the coding and documentation piece, and then the
Okay.
organization has followed up on their own for the rev cycle, the billing piece of it. We have been involved in a few instances for the rev cycle piece where we are following that claim.
Mhm.
And it's really all been on the professional side and facility side at this point. I have not had an IRO with the different payment models like a method 2 hospital or
Gotcha.
uh, PDMP for skilled nursing, that type of
Right.
thing. But I
Okay.
would imagine it would be the same regardless, right? You're still
Right.
following the claim, and with all of these projects for CIA, you're dealing with paid claims. If the claim hadn't been billed yet, it doesn't qualify for the review, for the independent organization to come in and do that review yet, right?
Gotcha.
You're dealing with just paid claims. And so that's why it's very typical to have that follow through with the claim and make sure that
Yeah,
it was processed correctly.
that makes sense. So so like, and the reviews you're doing, are they basically just overall claims reviews and they're having you look at CPT and ICD and modifier, like everything on the claim? Or do they get really specific? So like, let's say a practice, the reason they're under a corporate integrity agreement was because they were using modifier 25 inappropriately. So that was the reason for their settlement, let's say. And then one of the requirements of their CIA is to have an IRO. Do the IROs get that specific and say, okay, you're going to pull a sample size of X or whatever for modifier 25, since that's what brought you here? Or are they more general in nature where you're reviewing kind of everything involved in that claim, ICD, CPT, and modifiers?
No, they are very specific.
Okay.
Yep, so that scenario modifier 25 is a great example. We have seen that often. Level 4s and level 5 E&M services,
Gotcha.
and ancillary service of making sure that they're medically necessary. We've
Yep.
seen, projects like that as well. So they're very focused. It's rare that we would look at the entire claim. We would just follow that claim for the particular element
Gotcha.
that was part of the review.
Gotcha. Yeah, no, that makes a lot of sense. Like you're saying, medical necessity reviews, I
Mhm.
could see probably incident two. I
Yes,
don't know if those, because I've seen a lot of settlements with incident two. So I can imagine that some reviews might be focused on that as well.
that's right. And we have had not just IROs for Medicare claims, but Medicaid claims as well.
Ah,
So we've actually worked with quite a few different pediatric organizations.
yeah. Oh, yeah, that's interesting. Of course, yeah. I could see that for sure. That is so interesting. Stephanie, we're getting a little bit towards the end of our time together, but I was, want to always give you kind of last comments. I don't know if you have any last minute thoughts or maybe a topic related to IROs that I did not discuss or ask you about that you think would be interesting for everyone.
Yeah, I think if you're an organization and you're under CIA, I think you should embrace it and look at it as it is an opportunity to really improve your organization as a whole.
Hmm.
because typically it's a focused area that the CIA is focusing on, that you would need to bring in an IR for, but that doesn't mean you can't apply a similar type of audit across your other specialties or other practices within your organization, right? So it's really something that organizations should embrace. And then if you're looking for an IRO, I would be asking questions. Hey, are you familiar with the process? Because if you're not familiar with it, it's a little tricky, and you need
Yeah.
to make sure that you fully understand the process as you go in, and fully understand what your responsibility as an IRO is and what it is not, because you cannot overstep your ground when we're talking with dealing with the OIG, right? So we have to make sure
Yep.
that you understand that. So if you're looking for an IRO, I would ask those types of questions. I would also make sure that that IRO is an expert in that particular specialty. There's a
Yeah.
lot of groups out there that, hey, yeah, we have the experience, but are they an expert? So you'd want to ask those questions as well.
That's great advice. And I love your comment about kind of embracing it. I've seen a lot of organizations come out much better. In other words, after the CIA ends, and it's a shame if they just are like, "Oh, CIA is over. Let's stop all of those practices." It's like, no, these are the kinds of practices that will help prevent you from having to go through another CIA. Is so you put in the effort, you put in the sweat equity, if you will, to learn
Yes,
how to do these processes, keep those there, and like you said, apply them to other areas, and you kind of learn from the whole experience.
absolutely.
Such great advice. Stephanie, thank you so much for taking the time to share your expertise in this area. We really appreciate it.
Happy to. Thank you so much for having me.
And thank you to all our listeners for listening to another episode. As always, we invite you to share with us any topics you might be interested in hearing more about, or if you know a Stephani Scott in your life that is an expert in something, we'd love to hear names of people who might be willing to be on the podcast as well. So until next time, everyone, take care.